Welcome to Codonics. You know, despite a world of best practices, standards, and your pursuit of safety, medication errors still exist. In fact, 1 out of every 133 patients in the OR experiences a drug administration error. Many more go unreported. We're human. We make mistakes. The OR is a fast-paced environment. Vials and ampules are often small and look alike. Codonics technology provides anesthesiologists with visual and audible confirmations, acting as a second set of eyes. And once drawn up, clear liquids become impossible to tell apart. In fact, these syringes and labels probably look familiar. Codonics' game-changing technology eliminates those mislabeling errors. Let's meet someone who has been touched by a preventable medication error.
My name is Chris Jerry. I'm the president and CEO of the Emily Jerry Foundation. More importantly, I'm the father of Emily Jerry, who died from a very tragic preventable medication error in 2006. Tragedies like what occurred with my daughter are occurring all too often. Preventable medical errors are now the third leading cause of death in the United States, claiming over 440,000 lives a year. These tragedies can be eliminated. There is proven technology available today. Every facility should be required to implement these technologies, because we all know that these types of technologies, coupled with new and improved and evolving best practices, can prevent countless tragedies from happening again and again.
There is something we can do to help end preventable medication errors. Codonics' award-winning Safe Label System is an FDA Class II medication safety system. It uses barcode technology to improve safety, compliance, and efficiency during medication preparation. SLS helps to greatly reduce vial and ampule swaps, mislabeling, and syringe swaps anywhere medications are prepared. The system has two unique components. The administration tool software is used in the pharmacy, while the hardware is deployed to the point of care, like the OR, and brings pharmacy and anesthesia together to improve medication management in the operating room. Now let's meet Mark Chabot from the University of Virginia, where SLS has standardized medication preparation in their ORs.
One of the biggest benefits is that it gets us into the OR and procedure areas. Those were the Wild West, as it is in most institutions. If you're able to enter that venue and be able to create the standardization and bring them to a standard, you've accomplished quite a lot. It's a difficult area to crack, but this product makes it very easy to get into those areas and give them a benefit also. They see the positive to it. We see the positive in bringing in properly labeled syringes, standard concentrations, drips that have labels, and being able to manage that product proactively from our side, from the pharmacy side.
In the OR, SLS uses your pharmacy-approved formulary and barcode technology to identify vials and ampules. A quick scan of the manufacturer's barcode
neostigmine 1 milligram per milliliter
instantly matches the drug to the FDA-mandated drug database from your formulary. SLS provides clinicians with an immediate, audible, and visual confirmation of the drug in hand and full-color label. This ensures that the contents of the syringe and the label on the syringe are both accurate. Let's take a moment to hear what this means to anesthesiologists who are using SLS.
Now, this device over here, which is manufactured by Codonics, and really, I don't work for the company, I don't have any investment in this company. This is an absolutely brilliant device. I understand it was invented by an anesthesiologist at Harvard. And really what this thing is a safety device. And what it allows the anesthesiologist to do is to be absolutely certain that whatever drug he's drawn up or she's drawn up, she knows exactly what it is. I do believe that this device, I do believe it belongs in every OR, and I do because it is an ultimate safety device. It allows us to correctly identify medications, and to the extent that we then have to give them to patients, it's extraordinarily important. And something is either safe or it's not. And this makes the anesthesia process safe. And I'm a proponent of this. And this is consistent with the Anesthesia Patient Safety Foundation, who a number of years ago in their bulletin said, this is the type of thing that we need in our operating rooms. So I can't extol the virtues of this thing enough. This is a safety device. Just like, for example, when we give an anesthetic, we need to monitor inspired oxygen and expired end-tidal CO2. It's necessary. It's required. To me, it's not optional.
I guess the best way to sum it up with respect to patient safety is that the Codonics labeling system will reduce medication errors. It will reduce the wrong medication being mislabeled. It will reduce the potential that syringes will be out and exposed for greater than 24 hours. And it will reduce syringe swap and medication errors. In my opinion, it's been a great advancement with respect to patient safety.
In seconds, the anesthesiologist has a full-color, easy-to-read label that includes the drug name, concentration, preparer's initials, date and time of expiration, the diluent and dilution if required, and any warnings about the drug. This label is 100% compliant with regulatory requirements.
The Joint Commission could come in tomorrow because we're due for an inspection any time now. Our time period's now. I have no qualms about the Joint Commission coming in because you have a sense of relaxation about things because you have things covered. The Codonics Safe Labeling system takes care of at least 15 standards of Joint Commission that I know of right off the top of my head. I could probably look and see more. So it handles the Joint Commission standards that they look for.
To further enhance safety, every SLS label contains a unique barcode. When a barcode is scanned on SLS, it provides a triple check prior to administration. Additionally, the barcode can be read into the anesthesia information system, and it integrates with your existing hospital BCMA system. Now, in many facilities, pharmacies struggles in how to get standardization and compliance into the OR. Not anymore. In a few clicks, the SLS administration tool consolidates pharmacies' approved drug database and rules, such as whether or not a drug can be diluted. It's merged with the Joint Commission, ASA, and USP accreditation requirements to create a site-specific formulary. Each SLS accesses that database every time a drug is scanned, instantly introducing standardization. That standardization drives safety. Pharmacy's administrative tasks are also greatly reduced with the administration tool. 20 hospitals across Shriners has seen the benefits.
We found that it's very easy to manage. It's very easily updated. And even in our environment with a multi-hospital system, we found it acceptable to create formularies for each hospital as opposed to a large database. So we've easily done that across 20 hospitals.
I think the greatest benefit to pharmacy is that we don't have to worry about labeling practice in the OR any longer. When Joint Commission comes or any surveying agency comes, accrediting agency comes, we know that we have a system in place in practice that is considered to be kind of best in show for how we standardize practice in our OR environment, ensure that labeling is happening with the appropriate expiration, medication concentration, all the information and the initials of the provider that actually prepared the medication. Helps us sleep at night.
Peace of mind. SLS brings medication safety to a new level. Honored for innovation, the system has been recognized for best practices by Frost & Sullivan. They independently reported that in the clinical use of SLS, users reduced errors by 95%, improved efficiency by up to 30%, and improved compliance and safety in connection with reduced near misses. Leading hospitals from around the world have implemented SLS as a standard of care. Let's meet Christina Barnes from Avita Health System, who has made medication safety a responsibility and a priority.
Safety is important for us. It's a priority. We don't want to be the hospital that has the headlines of a patient had a medication error, a fatal medication error at our institution. But it's more than that. I think as healthcare moves forward, we have to take responsibility that we don't cause harm to our patients. And when you don't have a technology out there, we can sit there and think, well, gosh, it'd be nice if that were available. But now once you know something's available, it becomes your responsibility to make sure that you're not causing harm to your patients. And there was a technology out there that could have prevented that, and you chose not to implement it.
We hope it's clear. Safety is important to Codonics. So important that we've partnered with the industry's leading manufacturers to improve medication management in the OR. Whether you use standard anesthesia utility carts or automated carts, Codonics has a solution for you.
I'm pleased to share that CareFusion has recently expanded our partnership with Codonics, and we're working together to develop advanced integration between CareFusion solutions, Codonic technology, and HIT systems. What this means for our customers is simplified pharmacy workflow that eliminates redundant manual tasks and synchronized formulary management that reduces the chance for error. CareFusion has exclusive rights to this new capability and can now deliver formulary synchronization across multiple systems, helping hospitals drive standardization and further leverage their technology investments to increase medication safety across their entire healthcare system.
Codonics and Plexus Information Systems provides a completely integrated solution to remove the element of human error while improving efficiency in the operating room.
Leading healthcare institutions like Massachusetts General Hospital trust Omnicell and Codonics to provide support for mission-critical management compliance. With anesthesia workstation integration to the Codonics safe labeling system, we are able to deliver connected workflows that offer the clinician a lean approach to medication management.
We'd like to leave you with one final thought.
One simple technology that would have saved my daughter Emily's life is barcode scanning. If we had had barcode scanning implemented in that facility where Emily was receiving care as part of the workflow, and it was available in 2006, my little girl would still be with us today.